4th of July was yesterday. Did you celebrate? Even if you didn't celebrate the United States 4th of July, because I know some people don't recognize it, but there is something about being free that should be recognized. And if you do not consider yourself a free person, if you're carrying around burdens or if you're enslaved as a nursing student to something, it does not feel good. It does not feel good not to have ownership of your time. It does not feel good not to have ownership of when and where you work. And a lot of nursing students or a lot of nurses who have not passed NCLEX cannot really celebrate independence in that way. If you have not passed your NCLEX, there is an area of your life that is in bondage, right? And so I wanted to come on here because it's Monday. You guys know we do how to talk NCLEX, how to pass NCLEX, let's talk NCLEX, and also Monday motivation. And it's just a thought that I had. Yesterday was the 4th of July. Many people watched fireworks. Did you? Yesterday, many people barbecued. Many nursing students had a great, wonderful time celebrating this idea of freedom. And then after it was all over, went back to a situation where they were not free. So I'm sitting here with the passageway to freedom in this area of life. Is it you? Are you the one still studying and still, or not even, just still carrying around this idea that I don't have my license? It's a heavy burden to carry. It really is. And it does not feel good. Every day when you clock into that job, there is no independence. They tell you what to do, right? They tell you how much they're going to pay you. They tell you when you're going to work. And so we have these moments, and that's why the holidays are so important, because the holidays sometimes allow us to escape. They allow us to escape our present situation. So, we purchase things that we know we don't need during holiday times. We celebrate when we know that we should be doing other things like studying. And nursing students let holiday by holiday by holiday go by, and they still, end up in the same situation. Right. So whether you celebrated the 4th of July or anything else, I wanted to remind you guys, don't let the holidays fool you. There is still a work to be done. There is still a work to be done. And that's you getting your nursing license so you can truly be free in your own personal estimation and in your career, Because once you get that nursing license, guess what? You will have the independence to practice anywhere. You got to take one test. If you pass that NCLEX, you can work in any state. All right. If you want to go to Hawaii, you can work in Hawaii. If you want to go to Texas, if you want to be a nurse in Florida, right? Shout out to my ReMar nurses that have passed NCLEX that are encouraging you guys right now, because it's true. It's true. And we had a sale all during RNU. We had a sale all during RNU on the NCLEX virtual trainer so that many of you could actually be taking those steps in studying. And so you can still check it out, remarnurse.com, if you want to get started today. I'm going to actually be quizzing you guys from this book. This is the quick facts for NCLEX. This is one of my study tools that I use to prepare nursing students to pass their NCLEX exam and get their nursing license. So this is part of my study program. And so today I wanted to do a little pop quiz, and I wanted to ask you questions because we still have to study. It has to be done. And if you didn't do it yesterday, and you're here today, we're going to do it today. So just do fast fingers. Also share this video. And if you have not liked my Facebook page, you need to do that. Okay. Or the YouTube channel, subscribe, because every time I go live, it is geared towards nursing students and helping you to get the very important information to pass your licensure exam. All right. So we're talking myocardial infarctions from Quick Facts for NCLEX. If you know the answers, put them on the screen very quickly. I want to see who is first. All right. Okay. We're talking myocardial infarctions. I just want to start off a very basic question. What is the cause of an MI? If a patient has a myocardial infarction, what is the cause of it? If you have this book, go ahead and type the answers on the screen. Try not to look, but if you must, let everybody know what the answer is. All right. What is the cause of an MI? It is very simple. It is a simple cause. This cause will always cause a patient to have a very painful myocardial infarction. All right. All right, let's keep going. Let's see. I want to see the answers on the screen. Okay. It is a decreased oxygen supply. A decreased oxygen supply will cause chest pain, shortage of oxygen. Absolutely. And let me ask you this. Where is that pain felt? If a patient is having an MI, where will they say they feel the pain? Where do you feel the pain at? And it's very interesting because men and women, sometimes they can present differently. So when a woman is having a myocardial infarction, she may feel different symptoms from when a man is having it. All right. But in general, the pain is a substernal pain. Okay. So it is below the sternum. If you think the word sub is below, like submarine, those are below the water, right? So substernal pain. And it's interesting because sometimes that pain will be felt in the jaw. It's so interesting. Sometimes that pain will be felt in the jaw and around and down the left arm. Down the left arm. My mom she was doing something cooking and she said, I have pain down my left arm. And I was like, what? What's going on with you? Because, sometimes women will feel pain in their arm, in their chest. Okay. Now, a true myocardial infarction is different from angina. I'm not talking about angina so much today. But if a patient comes in with a true heart attack, what two things will not help it? Okay, there are two things we give a patient. If they say they have chest pain, what are the two things we're going to give them? Just give me one. Just give me one of those things we give the patient. And usually, if it's not a true heart attack, the patient will feel better. The patient will feel better. So what is the one thing? If a patient comes in and they say, nurse, I'm having chest pain. It hurts so bad. I mean, I had a patient and he was pounded on his chest. He said, it hurts, it hurts, it hurts. One of the things we're going to give him is oxygen, right? We put oxygen on him right away. And if the patient still says, it's not helping, the pain still hurts, it hurts, we think, okay, this is not just angina. This could be actual heart attack. The second thing, yes, is nitroglycerin. And so if we give nitroglycerin, we give it 3 times, because you guys know we can give nitro 3 times sublingual every 5 minutes, and we give that nitroglycerin and the patient says it still hurts, we know that there has been some damage done to the heart. There's not enough oxygen getting there. Because what does nitroglycerin do for the heart? Nitroglycerin is going to vasodilate. It's going to allow the oxygen to come in, right? And so typically that helps with chest pain. If we give a patient nitro and everything opens up and the oxygen gets to where it's supposed to be, then the chest pain goes away. But if you give a patient nitroglycerin and they're still complaining of chest pain and they have oxygen on, then we know part of that heart, part of those cells may be dead. When you don't get enough oxygen, you die. And that happens on a cellular level as well. And so if part of the heart is dead, no matter how much nitroglycerin or oxygen you give it, it's not going to help. All right. So we do EKGs on patients who have chest pain that we don't know whether it's an MI or angina. And what we will see is ST elevation and inverted T waves, ST elevation and inverted T waves. If you are just joining us, we are reviewing the very important topic of myocardial infarction. Do you know the quick facts of this condition? You got to know it. If you're in nursing school, you need to know this. All right. So the acronym, when I taught my class last week, it was a practical nursing class, and they were reviewing for the NCLEX exam, and they also had ATI exit exams. And so there are 4 medications that we give for myocardial infarction. Let me see them on the screen. If you're a real nursing student, you know this. If you're a real nurse, you know the 4 medications that we give for myocardial infarctions. It's just as easy as ABCs. Yes, it's not ABCs, but it is Mona. It is Mona. And I see everybody just putting Mona on the screen. But there may be one watching, guys, who they don't know what Mona is. Is it a person? Is it a place? Is it a thing? What is Mona? Is it one thing? All right. Does Mona stand for morphine? Somebody asked me that one time. So we know that Mona stands for, yes, morphine. I wonder if you guys will just put it in order. Morphine. We give morphine for pain. Oxygen. Yes, very good. Oxygen, nitroglycerin, and aspirin. Okay, everybody knows that. Everybody knows Mona is given for a myocardial infarction. But is there a brave nurse out there that would like to tell me the order? What is the correct order? Because you don't give, if you had a patient with chest pain, Mona is not the priority of the medication. What is the priority of the medication? What do you give first? It is not. Nurse Hughes, do you know what medication for Mona do you give first? It's not morphine. All right. Mona stands for morphine, oxygen, nitroglycerin, and aspirin. But if a patient comes in, what is the first thing you need to give them if you suspect they have a myocardial infarction? What's the first thing? I see somebody put it down already. Is there somebody that's going to agree? Let's touch and agree that if our patient comes in with chest pain, the first thing we're going to put on them is oxygen. Absolutely. The first thing we're going to put on them is oxygen. Followed by oxygen. Yes. Followed by oxygen. Let's go ahead and let's get out the, you know what it is? Is it nitroglycerin or is it morphine? What do you guys think? I'm giving you 2 choices. Is it nitroglycerin? Is it morphine? What is going to be the priority for a patient with chest pain? Is it going to be to give nitroglycerin to open up the vessels, or is it going to be to give morphine to control the pain? Which one? Which one makes sense? We're worried about the heart dying. We're worried about the heart dying. And so absolutely it's going to be nitroglycerin. We want to give nitroglycerin over pain, right? So we give oxygen, we give nitroglycerin, we give aspirin third, and morphine is last. The pain medication, surprisingly, is last. Because remember, if a patient comes in with chest pain, the pain is not the priority. Okay? The priority is what's causing the pain, which is a lack of oxygen. So we got to fix, if you fix the issue, the pathophysiology, the lack of oxygen, the pain can get better, can lessen, and it can be treated last. Typically, if somebody is having pain, and this is what I say when I teach prioritization, if a patient is complaining of pain and that pain goes along with something else, they're not going to die from that pain. For example, if you have a patient who has a pain 10 out of 10 and it's because they have a tooth abscess, it's expected. They're not going to die from that pain. If you have a patient who has pain 10 out of 10 and they have renal stones, that's expected. If you have a patient and they have pain 10 out of 10, and they have just had a finger cut off in a trauma, it's expected. They're not going to die from it. If you have a patient with a blood pressure of 250 over 190 and they have pain, they might die from it because we don't know what's causing the pain. We don't know what's causing the blood pressure, right? If you have a patient and they have brain cancer and they're complaining of pain in their abdomen, they might die from it. I don't know what's causing it. So do you understand how pain has a scale of severity and priority? So if it's expected pain, that patient can wait. That patient is not going to be the priority. I get a lot of nursing students when I say, who would you see first? A child that was drooling or a patient with a gunshot wound to the leg. And nursing students who are not very familiar with prioritization will say, you go see the gunshot wound first. Absolutely. You go see the gunshot wound, Miss Regina. There's a trauma. But you don't go see the gunshot wound. Yes, it's a trauma, but if somebody has a gunshot wound to the leg, right? I know they're going to have pain. I know they're going to have bleeding. If somebody is drooling, that tells me what? What am I worried about if I have a child who's drooling? Typically, if a child is drooling, that means that they can't swallow. That means that saliva is not going down, right? It's not going down, it's coming out. And so a drooling patient may not seem very bad on the outside compared to somebody that blood is gushing out all over the floor and everything. But that gunshot wound patient should wait. That gunshot wound patient to the leg will live. And so these are the principles that you have to master if you want to be a safe nurse. NCLEX is not about you. NCLEX, let me say that again. NCLEX is not about you. And it is absolutely true. It's absolutely true. So you can disagree with me. Well, actually, the place that you disagree, with me on a lot of things, especially things that I know to be true. Okay, I know to be true. I don't come on here and make up things for you guys to waste your time studying. If I'm telling you something, it is because it's a nursing principle that I have learned, studied, and mastered. So if you disagree with me, if you think you should go see the drooling patient second over a gunshot wound to the leg, do that on your own page, because that kind of thinking will get somebody killed. And that is not what nursing is about. All right. When you take your NCLEX exam, it is not about you. It is about the people who you will be treating. It is an exam for public safety. It is an exam to keep people who don't know the prioritization of healthcare matters out of hospitals. It is very, very serious, but it's not about you. All the studying you're doing is not about you. It's about helping to save a life of somebody you don't know. It's actually about strangers, right? Nursing is like that. It's all about taking care of somebody that you have never met before, okay? And so if you want to teach another way to do something, then you can do that on your own page. You can make one and you can teach people. All right. So anyways, back to what I was saying before. The order of priority is oxygen, nitroglycerin, aspirin, and morphine. Yes, that's the order that we give for chest pain. Epiglottitis, that is what I was talking about. It is very serious to know. It's very serious to know. All right, so what we're talking myocardial infarctions. What is the activity level of that patient? Shout out to Nurse Divers. She says, thank you so much, Regina. I passed NCLEX RN last Tuesday. She says 529. Okay. So I wish that I could open my brain and put the quick facts before NCLEX, but unfortunately I couldn't. That book has so much things I saw on my test. To God be the glory. I am no longer a tech. I am a nurse. Thank you, Jesus. That is a testimony as well. That is a testimony. Oh my goodness, I love that. I am no longer a tech. You know, and there's nothing wrong with being a tech, but when you have the knowledge of a nurse, come on, let's get paid. Let's level up and get paid. Absolutely. Congratulations. Nurse divers, NCLEX RN, mastered it. Okay. All right. And we are always celebrating. This is what we do here. We say congratulations when somebody says they pass, because guess what? It is not an easy goal to do this, pass, fall, get back up again. It is very tough to do it. Right. So again, I had asked, what is the activity level prescribed for a patient with chest pain? Do we want these patients up walking around? Do we want them, ambulating? No, we don't. We want them on bed rest. Good job. Good job. All right. And then let's see. I'm going to ask you this question. What is the cause of unstable angina? What is unstable angina? You probably won't know the cause. What is unstable angina? Yes. There is stable and unstable angina. If this is in the Quick Facts book, so make sure when we're finished with the study session, you go over it again. This book will absolutely help you to pass your exam. It's this big. It's literally very thin. It is very thin, but anybody who has it knows that it goes over all of these topics in this little tiny book. So it is really like a wonder, and it's really cool for nursing students. I had this, I went to a little small island yesterday, and we took this book with us, and I just stuck it right in my bag. So what is unstable angina? Does anybody know? I'm still seeing, oh yes, good job. Unstable angina is actually pain when the client is resting. Sometimes people can have pain with activity, like the book says, if you do early morning exercises, if you shovel snow, or if you cut your grass early in the morning, or if you smoke, right? Or if you do exercises, sometimes you will have chest pain because you just have this burst of activity and your cells and your vessels don't respond quick enough to the increased need for oxygen. So people, when they get up in the morning and they see snow on the ground, they go out to shovel the snow before they have to go to work, and their body is still kind of waking up. It's like, hey, I'm not ready for this activity yet. So they have chest pain, which is angina, right? But it's not because there is something defective in the heart. All right. So unstable angina is a chest pain that occurs when resting, and says that what should you teach? What should you teach a client who has angina? Okay. What should you teach a client who has angina? And basically that is how to take nitroglycerin for pain, because angina will be relieved by nitroglycerin. All right. And we talked about how to give that. Okay. Also, we teach them to exercise, because exercise helps the elasticity of the vessels. And it'll also help if the client stops smoking. Okay, there you have it. It is super simple to study this book. It doesn't take long. If you are following the study calendar in this book, you can have this book mastered. Let me just see if I can get to it. Oh my goodness. Study calendar here. If you're following the study calendar in this book, you can have this mastered in 3 weeks. So it'll give you plenty of time to prepare for your NCLEX exam. Okay, guys. I saw your question. You said you ordered it off of Amazon and it's been 3 weeks. Please go back and check to see if you ordered it from another seller, we sell this book on Amazon. We sell the 5-star version, but there are other people who sell this book. Sometimes people will sell the original version of this book. And so those sellers may be experiencing a delay. Give them an email or give them a call if you can to see where your book is. All right. And if you have any questions for me, you guys can always email me, support@remarreview.com. Okay. Support@remarreview.com. That's my email address. If you just want to get this book, go to remarnurse.com. We send these out every day. I was in the office today. We had a slew of quick facts that we were sending out. Nurse Tanya, is it Tanya or Tanya? I absolutely love your products so much. They have helped me, but I'm not sure what I'm doing wrong. I'm going on my 4th try and I finished the last 3 times with max questions. I don't know what to do next. Do you have any suggestions? Great question. Typically what happens is if a student takes an NCLEX exam and they get a high number of questions, or they get all the questions and they still fail the exam, what I've come to know is that that student has a great content. They have a great content foundation. Where they struggle with is the critical thinking. It's the critical thinking. And so the exam is allowing you more and more opportunities because you are so close. You are so close. If you get all the questions on the NCLEX exam, you're very close to passing. Because if you were far away from passing, the exam is not going to allow somebody who is not even close to passing to continue on. You guys know it will shut down. You will get that blue screen and you will go about your way. But if the exam continues, it is allowing you another opportunity to get closer to that passing standard so that you can pass. And so sometimes when students have those multiple opportunities, it is because they're struggling with their critical thinking. They're getting it down to 2 and they're picking the wrong one. And so I would say questions do help you with that. Doing practice questions do help you master that. Oh, it's 2. Which one do I go with? But also, it's kind of tough because you have to prepare for the exam all over again. You're going to get a totally new exam. And so you still have to review your content as if you've never taken the exam before. And so one of the mistakes the students make after they after they fail NCLEX is they will only focus on questions, or they will look at that candidate report and they will look at, okay, I was low in this area, so I'm going to focus really hard on this area for my next exam. And then they do that and they get an entirely new test. And so they have not studied the other content areas. And so they may do really well on the one, but now this other section is low. So we have to, 2 things we have to do. We always have to keep our content first. If you're preparing for NCLEX, prepare as if you've never taken it before. Even if you're a repeat test taker, you have to cover all of your bases, and then do questions so that you can work on that critical thinking. You guys know I have a question bank. It's just $29. And there's 1,200 questions in that question bank. So if you want more practice questions after the virtual trainer, please see that resource. All right, because those questions are pretty tough. They'll make you think. Okay. So T asks me this question. I'll take your questions for a little bit, guys. So T asked me this. So the order to give meds for an MONA is O2, nitroglycerin, aspirin, and morphine. MONA is just the acronym, correct? Yes, T, that is correct. So the acronym for the order is actually ONAM. Somebody put that on the screen. I saw it before. ONAM. ONAM is how I remember to give oxygen, nitroglycerin, aspirin, and then morphine. Okay. All right. Okay, Low Crystal says, I ordered the VT last week. I'm ready to receive my study material so I can pass NCLEX. I'm so excited. I am so excited for you to get your material too. We do ship every day, but let me say this, with the holiday and with the sale, the final day of the sale was Friday. We had, I think, 267 packages to get out, which is a lot of packages. And then we ended up extending it because people kept saying, can you extend it one more day? So it went longer than expected. So we just had orders piling up, but I think everything is out except for maybe the international orders. So your package should be on its way to you. Thank you guys for putting ONAM on the screen. Okay. Brianna, does the question bank have a certain time frame that it has to be completed? With my question bank, it's unique because when you purchase it, you don't have to start it right away. You guys know with the virtual trainer, when you purchase the virtual trainer, your 3 months start when you purchase it. With the question bank, it doesn't start. You can pick when you want to launch it, And so you're able to do that. Okay. So once you launch it, then depending on if you bought the 30-day program, the 60 or the 90, then that's the time that you have. There are 1,200 questions in the question bank. So you have to think of how often you want to study. Do you need 30 days? Do you need more? All right. So that's that. Marie says, can a nurse be included on a malpractice lawsuit, even follow the doctor's orders? That's a great question. Can a nurse be sued for doing something that a doctor said do? What do you guys think? I love that question. Actually, the answer is yes. Okay, it is absolutely yes, because as a nurse, you have a certain knowledge of how to keep people safe. And so nurses are supposed to be the last defense for the patient. So if the pharmacy writes an order, if the physician prescribes a treatment and a nurse does it and it's wrong, it hurts somebody, God forbid, yes, the nurse absolutely can be sued and should be sued because we have a responsibility. Okay. It's the same thing as if a pilot was, flying a plane and people got hurt. We trust that license. And if the pilot did something he wasn't supposed to do, he should get in trouble for it. Okay. All right. Great questions. Kathy, I passed and I still read my quick facts. Okay. All right. I ordered and received VT. Should I stop doing before the books arrive? And in order to start, I have 90 days. So if you have the VT and you were doing the before the books arrive section, that's only until your books come. Once your books come, get out of that before the books arrive section and start the NCLEX review. All right. If you have time after your subscription, you can go back to that section, but you definitely should stop. All right. Some of you guys knew that. Yes. Yay. Nurse Dacer, I'm so happy to be back. Passed with your materials with my LPN. I just finished RN school last week. Congratulations. All right. Can a nurse question a doctor's order? Yeah, she better. You do it all the time. Because remember, even as family members even as a patient, you should always question a doctor's orders. Because number one, doctors can suggest something. Those orders are just suggestions. All right. And then number two, there's different levels of doctors. There are very brand new doctors called interns. You have seasoned doctors called residents, and then you have big important doctors called attendings. And if you don't know the difference between an intern and an attending, you better, because if I am working night shift, and I know if I'm working night shift, most new graduates work night shift, guess who you're working with? Are you working with a big person with 20 years of experience teaching and experts in their fields? You think they're up at 2 a.m. watching patients? You think they're up at 3 a.m. checking out people in the emergency room? They are not. Guess who is? Interns, a bunch of interns. And yes, interns have their medical license, but what they don't have is experience. And so, as a nurse, if I get a bunch of orders from an intern and they look suspicious, I just say, I'm calling the resident. I'm not, why am I giving dextrose to my patient who has diabetes? I'm calling the resident. And they don't want you to call the resident. They don't want that. Nobody wants to wake up the resident at 2 a.m. All right. So yes, be prepared, be bold, be fearless, be a nurse. Okay, because that's what a nurse is. It doesn't matter if you're talking to an intern, a new doctor, an old doctor. It has to make sense. Just say this, doctor, make it make sense for me, because I'm the one that has to go in there and explain it. I'm the one that has to give this medication. Make it make sense. All right. And they'll give you a second look. All right. Somebody says, can I just pass with VT? With Quick Facts. Quick Facts, again, just really quickly, is a part of the entire program. So it's just one book. And so if you are just studying with this book, you are still responsible for the other topics that I actually lecture on. There are some things I can put in here very quickly, myocardial infarction, the immunization schedule, but there are other things that most nursing students need explanation with, like math calculations, prioritization, infection control. And so those things you still have to know. All right. So if you can, which honestly, most NCLEX reviews are like $300, $400. My program is so affordable that I believe you can get the full thing, be really prepared. Okay. India says, no, you need the VT. Yeah. And a lot of people say, yes, Quick Facts does not cover everything. It is not meant to be. Never was. It's called Quick Facts. And so a lot of people say, oh, I'm doing ReMar, or I did ReMar and I failed. And then when we ask them, okay, did you finish the VT? They're like, I just had Quick Facts. I just did Quick Facts. All right. Okay, guys. So I'm going to get out of here. I held you too long. I was supposed to just do a short live video, but you guys always come on and you rock it. You rock my lives. And so I appreciate so much your time. Thank you for studying with me today. We studied from the Quick Facts for NCLEX. If you have not gotten it, please get it. All right. It makes no sense not to have it if you're a nursing student, if you are studying for your NCLEX exam. Check out remarnurse.com. And if you want to message me, please email me, support@remarreview.com as well. And we can talk more about how to help you pass your NCLEX exam. Thank you guys so much for watching. I always say this, you can, you will, and you must pass NCLEX.